It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And as always, you can download our podcasts at hotzepodcast.com. That's HOTZE podcast.com. So thrilled to have this guest on today, Dr. Stephen Sinatra. And there's so many misconceptions about heart health, which is crazy, right? Because there's so much information about cardiovascular health. It's always a hot topic, and yet a lot of false information out there. So we're so pleased to have Dr. Sinatra with us on the program. Dr. Hotze.
Thank you. Now remember, I believe that you and every individual needs a doctor and staff of professionals who can coach you on a path of health and wellness naturally, so as you mature, you enjoy a great quality of life. You're brimming with energy, you got get up and go and got enthusiasm, and you're not having to take all these pharmaceutical drugs. And I like to associate with other physicians that hold the similar view, that coach their patients on a path of health and wellness. And one of the most influential doctors in natural approaches to health, some people call it integrative medicine or functional medicine. I just call it natural, good old-fashioned, healthy, good, common sense natural medicine. And this is what Dr. Sinatra practices. Dr. Sinatra is a cardiologist who practices in the Hartford area of Connecticut in a city called Manchester. And we're going to ask him how he developed his integrative approach to treating cardiovascular diseases. But what he has done, and I've followed him, and I've read his books and his articles, and he's taking people that were on death's door and used natural approaches to health and revived them and had them live out scores of life, 10, 20, 30 years after that. His expertise is grounded in 35 years of clinical practice, and he was chief of cardiology there at the Manchester Memorial Hospital for 18 years. He was in charge of medical education. He founded the New England Heart Institute Center there in Manchester back in 1987, and he's been a prolific author and a prolific internet, having a website where he gives information to his patients and has hundreds of thousands of people that follow his work and take his recommendations as far as vitamin and mineral support and other recommendations for good health. So, Dr. Sinatra, it is my honor and privilege to have you, one of the leading doctors in natural approaches to health in America and in the world, on our program
Welcome.
today. So welcome to you.
Well, thanks so much, and that was a very gracious introduction, by the way. So,
Well, I meant everything of it. I was so excited when I saw that you were. If you're like me, you're busy, and so you get these things handed to you. Okay, Tuesday is my day where I do podcasts. And so it came on my desk last night. I looked down, and there was Dr. Tenpenny, and then I pulled. I said, well, that's great. That'll be an interesting conversation. Then I pulled back, and they got Dr. Stephen Sinatra. I went, holy cow, this is payday today. So I've been looking forward to this visit. Now, Dr. Sinatra, just so our listening audience can know, tell us about your background, where you grew up, where you went to college, and where you went to medical school, and how you ended up deciding to go into cardiology. And then tell us the story of how you made your transition where you decided to go off the rails of what normal cardiologists might do, and you decided to adopt or investigate and eventually adopt more natural approaches to helping people get well.
Okay, yeah, that's sort of a mouthful, but if I can,
that was a long question. Start from the beginning.
Weave this together. My mother was a diabetic when I grew up, and when I was 12 years old, I used to come home from school, and sometimes I would find her on the floor in sort of a diabetic shock situation or a coma, and at an early age, I decided that I wanted to save my mother unconsciously. I mean, that was my unconscious belief, and the unconscious drives are much stronger than the conscious ones.
Sure.
I learned that later when I pursued a psychotherapy training program. But in high school, I was an athlete. I was a wrestler, and I got into college on a wrestling scholarship. And and with my mother's background in diabetes, I decided to go pre-med, and I got into medical school, and then basically trained at Albany Med, and took a lot of electives at Yale. I took gastroenterology at Yale, dermatology at Yale, did my neurology training at Yale, and then when I was in 2 years of cardiovascular fellowship at St. Francis Hospital and Medical Center, I did my pediatric cardiology at Yale as well. So I was fortunate to have Yale only about an hour from where I was in Hartford, and I became board certified in internal medicine and cardiology, and I was on a great career, and I was conventionally trained. And then all of a sudden, when I passed my boards in cardiology, I was only 31 years old. I met this Dutch chemist on a telephone. He was a 91-year-old chemist. His name was Jacob Rins from Holland, and he was a PhD, and he was treating some of my patients in common. And there was one patient from Ohio that had high blood pressure, and I got on the phone with Rins, and he needed bypass surgery, but he never had it done. He said, I cured my atherosclerosis. And I said, geez, that's interesting, and I go, how'd you do it? And he said to me, I'll never forget it. First of all, he's 91 years old. He's erudite. He's funny. He's sharp. I mean, he's quick. And if I make it at 91, I would love to be just like him. And he's stating, well, I started phosphatidylserine, phosphatidylcholine, various forms of vitamin E, magnesium. And to be honest with you, I didn't even know what he was talking about because and I'm writing all this down. And as soon as I got off the phone with him, I just felt this glowing energy to become more like him in his training. So I became a traditional cardiologist in recovery, so to speak. And I started to take courses in nutrition. I went into a psychotherapy training program in Gestalt and bioenergetic psychotherapy, and then I ended up becoming certified as a bioenergetics. It took me 10 years of training postgraduate after medical school. And then I took the boards for the American College of Nutrition, and I wanted to learn, more about nutrition. And then I wanted to learn about anti-aging medicine, so I took that, certification examination. And so my background has been in mind-body medicine, anti-aging medicine, nutritional medicine, vitamins and minerals, and I started to make my own formulas back in 1990 when I wrote my first book, Lose to Win, and I started to use Coenzyme Q10 in the early 80s, and I met Carl Folkers and Fred Crane, who discovered CoQ10, and I met all the big leaguers in CoQ10, and
right.
Dr. Beliznikov, and but they're all deceased now, and so CoQ10 became a big interest of mine in the early 80s, and I've been using it for like 35 years now, and I've written a lot about CoQ10, books on it, peer-reviewed literature on it. I've done independent research in the mouse model, the horse model,
right,
the human model.
Now,
so CoQ10 has been a big, a big weapon, so to speak, in my arsenal of treating, people. Because, look, a good doctor, and you sort of said this in your introduction. I mean, all of us doctors use pharmaceutical drugs. I mean, look, as a heart specialist, when I have a person who's dying or in pulmonary edema or a massive heart attack or complex arrhythmias or heart block or, if they're in an emergent situation, doctors like myself will use any pharmaceutical drug it takes to save that person. It's almost like a child with refractory asthma, or status asthmaticus. You will use anything you can to get a person to feel better. But where a lot of the medicine falls apart is in the treatment of chronic illness.
Right.
And the problem that I see where medicine is going today is too many doctors are relying on pharmaceutical drugs to treat chronic illness, not emergent situations, not emergencies, whether it's obstetrical or neurological or cardiac, but they're using drugs too quick on the draw, and a lot of these drugs have side effects, so we have to be careful. And meeting Rins at my early age was really an aha for me, where it got me on the right track, and so I'm sort of an integrative physician, in emergencies and in situations of profound heart failure. I'll have to use pharmaceutical agents, but then when I get a person stable, then I'll use my nutritional diet therapies, mind-body interactions, grounding, earthing. I mean, it all comes together, because what any good doctor wants to do, anybody, alleviate suffering in their patients. That's what we're here for. And if that includes pharmaceutical drugs, so be it. If it includes earthing or nutritional therapies or vitamin and mineral therapies or mind-body interactions, all the better. So that's sort of the doctor I've sort of emerged into over 40 years. So I hope I didn't bore you with that long introduction, but that's what happened.
Listen, people love a story. How did you get to be where you are and to be such a strong advocate for natural approaches to health? And what was the pathway? All of us, is meeting with other physicians in the field that we're in the integrative or natural approaches to health field. When we meet other doctors, they've all got stories of how they got there. Something happened. It was interesting. What if you hadn't made that call to Jacques Arentz? What if you hadn't made a call that night and talked to him? What would your life? What if you didn't know him? What would have your life been like? What would have happened to all the tens of thousands of patients or hundreds of thousands you've helped online? What would have happened to them? So it's interesting how God in His divine providence brings things into our lives that change the course of our lives. I mean, that's dramatic. Did he have any articles? Did he have any writings, Jacques Arentz?
No, I mean, he did, but he was a Dutch chemist. And he was an older guy. Like I said, he was 91. I mean, he was a PhD in the chemical oil industry.
Isn't that fascinating?
And then he just branched out. He developed a rinse formula. It was a vitamin nutritional program that I started to use.
How does he spell? How did he spell rinse? R-E-N-S-E.
R-I-N-S-E. Rinse. Jacob. Well, they call him. The Dutch is Jacob, but it's Jacob Rinse, PhD.
Interesting. And he had
that's how I got started. But you're right. I think God has a big hand in this. When I met Tommy Roser about 8 years ago, and we wrote the book Health Revelations from Heaven and Earth. I mean, when Tommy was run over by a car and went back to heaven and back, I mean, he was planted in my path for a reason as well.
Right.
And one of the things that, as a heart specialist, that I've had the unusual experience of is that I resuscitated about 20 people who had stories to tell me. In other words, they went through the tunnel of light, they went to the other side, and they came back. So when I met Tommy, who had the most profound life after death experience that I've ever encountered. I mean, Tommy tells me 20 years on Earth can be like 4 minutes in heaven.
Mm-hmm.
I mean, it's like incredible. But Tommy spent probably 15 minutes in heaven, which could be the equivalent of 30 or 40 years on Earth. And the knowledge that he got inculcated into his brain when he was with Jesus Christ in heaven was incredible. And that's why we wrote the book, Health Revelations from Heaven and Earth. And one of the greatest joys I've ever had in my life was meeting Tommy Roser, because he validated, a lot of the theories I was proposing, the Coenzyme Q10,
right.
metabolic cardiology, grounding. I mean, all that stuff was verified in heaven by the ascended masters. So,
is that right?
I mean, yes. I mean, for me, meeting Tommy was unbelievable.
What's his last name again?
I think it's Rosa.
Rosa, R-O-S-A. And that book, that was my last book, the Health Revelations from Heaven. Doc, I'll send you a copy of it. I have some in my office.
Yeah, well, that'd be great. I'd love to have a signed copy. That'd be great. I'm going to get Stacy to order one just in case you forget.
Yeah, just make sure you email Joanne and
we'll do that. We'll get
you a copy.
Now,
and Tommy, somebody should have on your show if you want to talk about the sort of spiritual, metaphysical elements of healing. I mean, he's amazing at healing. He's a great healer himself. And he survived against all odds. And he's incredible. It's unbelievable what he has survived.
I'll get his number from you at the close after the program. We'll do that. Now, in talking about Coenzyme Q10, now those that know me know that in part of our regimen here at the Hotze Health and Wellness Center, we put almost all our guests on Coenzyme Q10 at some dose. And Coenzyme Q10, of course, is very important for energy production within the cell, particularly within the cells of the heart. And it enables the body's mitochondria, the power plants within the cells, to produce and use energy and transfer that energy in the form of a currency called ATP, those electrical currents. Coenzyme Q10 is very important for that. for the energy production within the heart. Now, the doctors have come out and the pharmaceutical companies have come out with this idea that it's a bogus idea. I think it's a myth. It's a hoax. That cholesterol is the cause of heart disease. And so we've got a bogeyman, and hey, why don't we make a drug, and this drug will lower cholesterol, and we won't have any problem with heart disease. We're going to heal people. Well, it turns out that the statin drugs, whether it's Lipitor or Crestor, whatever the doctors prescribe, they adversely affect the liver's ability to produce coenzyme Q10. So, doctor, tell us your take on the statin drugs and its adverse effect on cardiovascular function.
Sure. I mean, statins. There's no question they have a light side, but they also have a very, very strong dark side. And statins are not for everybody. I mean, I used to be the cholesterol choir boy when I was chief of cardiology at my institution. I used to lecture for Merck and Pfizer, and this is when I was young in my 30s. And then I used to believe in the cholesterol theory of heart disease until I read an article that was produced in 1982 in the Indian literature. It came out of India, where they were, or it was 86 or something. It was when statins first came out, or it could have been 1990. But basically, it said that statins are marvelous cholesterol killers, but they also knock out the same pathway that produces coenzyme Q10 in the body. And I had a huge disconnect when I read this article, because I said, how can something be so good for you, be so bad for you at the same time? So I stopped lecturing for Merck and Pfizer, and I didn't lecture on cholesterol anymore, and I wanted to dig really deep into it. And then some of the medical journals asked me to write articles about, or editorials about cholesterol, and I did, and I really researched the topic. I mean, I really read everything I can get my hands on. And as a board-certified cardiologist, I realized in my, I'd say 50s, this is about 20 years ago, that, statins did have some utility, but not by lowering cholesterol. And the West of Scotland study really showed this. This was a good study that was done in the early days of the statin drugs. They took these high-dose, smokers. They smoked about 2 packs a day, these men in Scotland. It was a West of Scotland study. And it showed that in smoking males, statins had an advantage not only in preventing heart attack, but a slight advantage in longevity. And it really impressed me. But the researchers of the study said that it wasn't due to cholesterol lowering. It was due to the fact that statins have a blood-thinning effect and an antioxidant effect as well, and that really appealed to me. So when I did more research on statins, I realized that statins in a certain population, and the population is really men, and it has to be young men, men less than age 75, where if you want to use the antioxidant potential and the blood thinning potential of a statin, that's okay with me if you're treating a male with far advanced coronary disease, but you have to give coenzyme Q10 at the same time. I mean, there's no doubt about it. Now, would I give statins to children? Absolutely not. Do I give them to the elderly? Absolutely not, because of the central nervous system effects, the confusion, the memory decline, et cetera, et cetera. And women, I don't believe in statins in women, even women with far advanced coronary disease. The only time I give statins to women is if they're really getting out of hand, if they've had, re-bypass, if they've had, accelerated coronary disease, despite, only natural interventions I've done. I mean, but statins have a small role to play. But again, young men, even with familial hypercholesterolemia, where we get cholesterols of 5, 6, 7, 800, some of these young men, will far better on statins, especially if they've had MIs in their 30s and 20s. And I've had men in my practice like that. So,
but that's a very small subset of the population.
That's a small subset.
Of the population that's taking statin drugs now. Listen. I have a friend that one of my staff members that works as a maintenance man had some chest pain, and we took him over to the hospital across the street, and they said, well, they did angiogram on him. He said he had a blocked LAD, left anterior descending artery, and needed to have bypass surgery. So I asked the doc, and he said, I put him on, and this fellow's, I guess he's got to be in his 60s, and he said, I've got him on statin drugs, I've done this, that, and the other thing. I said, let me ask you a question. Did you check his coenzyme Q10 level? No. Do you check? I said, do you ever, this is cardiologist, do you ever check the coenzyme Q10 level on any of your patients? Oh, no, I mean, there's really no proof that it really, started to double. And no proof that any difference in coenzyme Q10, blah, 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 But I called him, and he hadn't, and then I have another guest of ours, a young man who went to the Heart Institute here in Houston. Of course, Houston's a big heart institute with Cooley and DeBakey and the whole bunch, And
I sent patients to DeBakey decades ago.
Yeah.
Go ahead.
So anyway, this young man is about 28, and he was diagnosed down at the Heart Center as having cardiomegaly, cause unknown. Didn't know why he had it, just had it. But he was being seen by the cardiologist that was head of the transplant. He was the head of heart transplant. And he said, these are the 4 steps we'll go to. We're going to try to treat you with drugs, then we're going to put a pacemaker in, and then we'll try something. If that didn't work, we'll do a bypass. I will do transplant. And so I came in, and his mother had asked me to see him personally. I see very few guests, maybe 20. But anyway, I decided I'd see him personally. And so I visited with him about his problems. And interestingly enough, I looked at all the blood work his cardiologist had done, and, it's a standard deal. But he told the cardiologist, well, I'm kind of feeling a little depressed. Well, I'd be depressed too if somebody was telling me I'm going to have to have a heart transplant. And he's on track to get a heart transplant. He's in that program, and they're going to get him a heart transplant. They'll just do it step by step, but he's not going to get well. You just know that because you've seen it before. So under standard conventional medical care. So the doctor sends him to see a psychiatrist who said, well, you need to take an antidepressant. He just got it the day before. I said, you don't need an antidepressant. I don't believe in those things at all. So you don't ever take one of those, ever. That's just poison. You don't ever take that. You're not depressed because you're low in, Effexor or Paxil or anything like that. That's not why you're sick. But I looked on this blood test, and the cardiologist had done a coenzyme Q10 level.
Oh, great. It was probably in the basement.
It was in the gutter. It was 0.1 or 1 or 0.1. It was down on the bottom. And I went like, now why would I didn't talk to the psychiatrist. Why would the psychiatrist check a coenzyme? Well, he must be thinking out of the box. He's checking other things that most doctors never check. And so I brought the young man back in. I said, well, I told him right there, I said, look, I know you need coenzyme Q10 before I looked at the test, but your doctor didn't even do a coenzyme Q10, and he doesn't have you on coenzyme Q10. He had him on beta blockers. He had him on, you name it. He had him on ACE inhibitors. He had him on everything. You can plus diuretics, and you name it. He was on a pot full of stuff, all the things and plus, I don't know if he had him on a statin, but he was on everything. And I said, look, you need coenzyme Q10. And I sent him an article. I literally went and read your articles on the treatment of that to make sure I was going to be aggressive. And I think I have him up now to 600 milligrams. And he hasn't gotten worse. He's working now. He's not having any orthopnea or dyspnea. He's doing well. Exertional dyspnea, he's doing well. His energy level isn't back where he would like it to be, but
he's a relatively new guest.
Yeah. It's only been a couple of months, but I say that whole point in that I talked to there's 2 different cardiologists I've come in contact with, and neither one checked coenzyme Q10, nor do they give coenzyme Q10.
No,
but they put them on statin drugs. How can they now, doctor? It's not like this is not in the literature. This is well known and well documented in the cardiology literature.
No, it is.
How do they not? You know Sherry Rogers, don't you?
Yeah, I know Sherry. Yeah.
Well, Sherry's she's outstanding, and of course I've read her books, a number of her books, but she has the one book, Is Your Cardiologist Killing You?, which is just a fascinating read. And she just goes through and says, this is all, and she got it all, it's all documented in the literature. What are they thinking? So it's amazing. You have had the strength of personality and of ego to do what was right and figured out a way to do it and still make a living. A lot of guys would like to get out of the insurance-based product, but you and I both know that when they're in there, they have clinical practice guidelines they got to follow. If they don't follow them, they don't get paid. They're out of the program. So you're pretty much locked in to what the insurance companies say you've got to do. How have you been how have you worked around that? Is that why you set up your own separate?
Well, I really didn't have a lot of difficulties because I had so much training behind me and so many board certifications, and even when I was practicing cardiology on a day-to-day basis, I had written about 10 to 15 books. Now I have about 25 books. And you know as well as I do, I mean, when you write a book and not an expert, you realize, how much you didn't know. So, when I was writing all these books and writing all these papers in the medical literature and really studying Coenzyme Q10, I sort of empowered myself more and more. So I never really suffered, like some of my contemporary colleagues did. I will tell you this about Coenzyme Q10 because it's something that I feel that I'm very close to, and I'm just blessed that I met many of the world experts in it before they died. But like with the modern medical establishment, the way it is now, and even in the patient you were taking care of, there are so many pharmaceutical drugs that deplete Coenzyme Q10. Antidepressants do it, beta blockers do it, some ACE inhibitors do it. Oral hypoglycemic agents that patients take, for blood sugar and diabetes,
right.
They do it. So there's so many drugs that doctors unknowingly are giving their patients that deplete Coenzyme Q10. And the problem is see, you know this and I know this, but the Coenzyme Q10 is really the master spark plug of the body. It's no question. I mean, it is the one element that we need to fire our mitochondria, and without the mitochondria firing, energy production goes down. And even in this patient that you put on the Coenzyme Q10, just remember that metabolic cardiology, requires ATP.
Right.
Now, the center of the ATP ring is ribose.
Right,
it's
and
a
I give
five-sided sugar.
Right.
So in most of my patients, well, I would say every one of my patients with heart failure, I would
I'll get
always
them on-
add ribose to it.
Right, I did.
When you're adding ribose, you're giving them ATP substrate.
Right. Right.
Which the Coenzyme Q10 helps to turn over. And I'm sure you put them on carnitine and magnesium
Oh, yes,
as well.
Oh, sure. I got him on that plus vitamin C, and I have a whole vitamin regimen. I was going to...
And Doc, you're gonna prevent so many heart transplants. I mean, I must have prevented, this is not an exaggeration, I would say 80 to 100 heart transplants in my career. I mean, I've had so many patients that were on heart transplant lists that came off. I have one now. This is amazing. I saw an 8-year-old boy about, he's 31 now. So was he 23 years ago?
Mm-hmm.
I saw an 8-year-old boy in my office. I'll never forget this. The parents were crying. They were sobbing. They couldn't find a heart transplant for their son, and he was dying. And they came to see me because I heard about what I was doing in adult cardiology and blah, blah, blah. So I put him on CoQ10 and only carnitine and magnesium at the time. I didn't even know about ribose back then.
Mm-hmm.
And he's refused heart transplant 3 times now. He's the oldest living singlet outlet, double outlet ventricle in the world. He's in his early 30s. It's amazing. But it's even some of these congenital heart problems. I mean, you've heard of tetralogy of Fallot.
Yes.
Have you dealt with that one?
I haven't ever
I had
dealt with it.
a
but I-
newsman fly up from Brazil whose daughter, he couldn't afford the $700,000 for the operation on his daughter. And he put her on metabolic cardiology when she was like 2-3 years old. Now she's 15. And
she has
never had the
tetralogy of
operation.
Fallot.
She had tetralogy
Wow.
of Fallot. Oldest living tetralogy of Fallot. And so, see, I'm glad we got into this little aspect of metabolic cardiology because in 2009, I read this article from the Scandinavian literature. It was in the journal called Nature. Have you ever read that journal before?
No, I haven't.
It was by Swedish colleagues, 2009, and I got to tell you, Doc, I never felt such joy in my entire life after reading this article. Because back in 2009, I would question why all these patients I had on metabolic cardiology were living. I couldn't understand it when, they had ejection fractions of 10, 15, 20%, and then all of a sudden they would live 5, 10, 15, 20 years. It was like,
It was like a
incredible.
miracle.
Like a miracle, and there was too many miracles happening. Because remember, in medical school, I don't know how old you are, but I'm like
I'm your
early
age.
70s.
Yeah, I'm 60,
And
67.
I remember in medical school, the 5-year survival of heart failure was worse than cancer.
Yeah.
That's what they taught.
I think it still is.
It is. It
Yeah.
is. So basically, when you treat conventional, when you use the conventional approach to heart failure, I mean, ACE inhibitors, diuretics, pacemakers, digoxin, they can only go so far. You've got to build energy into those starving heart cells for energy.
Right.
And that's where metabolic cardiology comes in.
And the
So,
the big four on that are coenzyme Q10, magnesium, L-carnitine, and D-ribose for sure. That's the building
Correct.
block. That's the foundation.
Sometimes I had to use taurine, and sometimes I use licorice. I mean, I use anything that would work.
Right.
I mean, but basically, the basic of metabolic cardiology with the 4 nutrients you mentioned. Now, here's the deal. Here's the deal on that. When I read this article in 2009, I had this great joy because
What was the article about?
it was about the Cold War and about the atomic explosions that were done in Nevada and New Mexico in the 1950s. It was about carbon-14 testing. Are you familiar with carbon-14 testing?
No.
We can tell the age of all our cells in our body because
Okay.
of the radioactive nature
Okay.
of atomic bombs being blasted in America.
Mm-hmm.
I mean, this is amazing stuff. This is out of science, right? So in other words, they can tell the age of your cells. Now, what came out of this article in 2009 was that our own intrinsic stem cells, the stem cells in our bone marrow and our
Right.
fat cells, and by the way, this is the hottest thing right now in medicine,
I know.
is stem cell implants. I mean, everybody knows about this.
Right.
But what we didn't know is this, Doc. This is what we didn't know. We didn't know that our own intrinsic stem cells are in our fat cells, our bone marrow, and they work until our early 80s. Now, suppose you devised a nutritional program that could excite the stem cells to do their job.
Right.
That's where metabolic cardiology comes in. In other words, metabolic cardiology turns on ATP. And ATP, now I can't prove this, there's one missing link, but an article came out in 2017 by the same group of researchers where they verified their data in 2009, and it's showing that stem cell revival or stem cell renewal by taking agents that can excite your intrinsic stem cells, it's almost like developing a new heart. And that's what I think is going on with these people. That's what I think what's going on with the tetralogy of Fallot, the doublet outlet ventricle, all the cardiomyopathies I've seen, is that the metabolic cardiology is breathing life into our own intrinsic stem cells
yeah.
to do its job, to do their job. Isn't that amazing?
Yeah,
That's
that
incredible.
really is amazing. We're very interested in stem cells. Don't have time to cover it on this particular topic. Would like to do that, but I want to visit with you after the program because I've got some very interesting developments that have happened along that line.
This concludes part 1 of our interview with Dr. Stephen Sinatra. Please stay tuned next week for part 2. And in the meantime, if you want to take charge of your health, do a 180, please give us a call at 281-698-8698. That's 281-698-8698. Thank you for joining us here today at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.